we're a training facility and we've got a sustainability strategy where we want to become carbon and waste neutral by 2030. We know that our vision is to create healthy people and a healthy place. And we feel that sustainability is definitely a part of that equation in terms of our core business being patient care, but we need to also look at the environmental impact. I think it's about understanding our waste. We know that we procure lots and lots and lots of different things, but what actually is it? How do we procure it well? But then how do we manage our waste? So I think it's really about identifying those two areas, supply chain and then also waste management. For us, it was really, really important to, engage with people with this, I guess, specific expertise. I think for us, having an equipment supplier to help with the decision-making process was vital. We thought we knew what we wanted at one point, and then as we started to sort of unpack where we were heading in terms of our actual opportunities and what that could evolve into, that decision-making process changed based on the knowledge management. So I think, for us, we're, indebted and we're grateful to that. So it was about really ensuring that that we could future-proof and make sure that the journey could continue. One of the things that we really wanted to try to establish was to look at those low-hanging fruit opportunities. And one of those was the recycling of our KimGuard sterile wrap. And we produce over 20 tonnes of that from one of our facilities. Hospitals aren't set up to recycle well. They're not set up to ensure that we can, we have space on the dock, and they're the things that we've had to work through. So I guess for us it was about unpacking the solution, understanding that we had a large problem in terms of the waste management of our KimGuard. It takes up a lot of space. And what we're seeing now is that being diverted out of our compactors, our normal general waste, and being now baled into smaller manageable quantities for us to be able to transport out of the hospital setting. The recycling for us has been looking at where is our big opportunities, what can we do now. So we're now diverting 100,000 baby bottles from the facility. We're looking at the capture of a lot of our hard plastics from our theatres, the KimGuard, metal recycling. So there's a whole raft of different initiatives that our sustainability champions have been able to get up off the ground. Part of our strategy is that we wanted to create a movement. So for us, it's really about being leaders within this healthcare space to really be able to engage in sustainability. Together, we can only create this movement of making change. And for us, it's about what can we bring back into the hospital setting from those recycled goods to look at that complete life cycle, whether that be in the frame of new park benches, new tiles on the floors, for instance. So we're really looking at that circular economy piece. How can we ensure that the good work that we're doing inside the hospital is coming back into the hospital to tell that story? We're a long way from the end, but look, we are confident in the journey. We are looking forward to sort of making some inways into the hospital setting and really making change.